Hi guys, this is Dr. Gibson. Welcome back. Today we'll be talking about controversies in injectable weight loss drugs. So at the end of 2022, Ozempic went viral on TikTok and people are posting images of them losing significant weight with Ozempic. And shortly after, we had significant drug shortages of this drug. Now, Ozempic is a drug that's approved for diabetics and has the added benefit of weight loss. So really need to clarify just a little bit the labeling of the drugs. So the generic name for Ozempic is semaglutide, and semaglutide comes in 3 different formulations. Ozempic, which is indicated for diabetics, and this is an injectable once-a-week drug. There is Rybelsus, which is the pill form of semaglutide, which is taken on a daily basis, again approved for diabetics. And then there's the brand name called Wegovy, with the dose recommended of 2.4 milligrams that is indicated for weight loss. Therefore, Ozempic and Rybelsus are not specifically indicated for weight loss, but are indicated in the management of diabetes mellitus type 2. There are other injectable weight loss drug. Another injectable weight loss drug is called liraglutide. And liraglutide as well comes in 2 different formulations. There's the brand name Victoza that a lot of people are familiar with. And again, this is a once-a-day injectable drug. And there is the brand used for weight loss, which has a different number of milligrams. So it has 3 milligrams. In terms of just kind of meeting that numerical dosage for maximum weight loss benefits. So the brand name for this liraglutide formulation that's used for weight loss is called Saxenda, and it's administered once a day. There are other types of GLP-1 injectable drugs, but Wegovy and Saxenda are the only 2 that are approved for weight loss. There's another drug on the horizon called Mounjaro or tirzepatide, and this is also a once-weekly drug that is approved for diabetes and actually got approval less than a year ago. In May 2022, Mounjaro hit the market as a new drug for diabetes with significant weight loss benefits. And this is a combo of GIP as well as GLP-1. All of these drugs, even with the discounts on GoodRx, run you about $1,300 to $1,400 a month. So how do these GLP-1 drugs actually work? Well, they mimic the action of the glucagon-like peptide, which is an intestinal hormone that actually is stimulated by eating, and it stimulates the pancreas to produce insulin and basically delays gastric emptying as well. It causes the decreased secretion of glucagon. So what are potential side effects of these drugs? Well, considering the mechanism of action, definitely the side effect that we see the most is a lot of nausea and sometimes vomiting, and this is because it slows down the stomach. That is why we have a specific titration dose for each of these drugs. So the dose is increased gradually. In terms of the once daily liraglutide, it's increased weekly. And in terms of the semaglutide, which is once a week, the dosage is increased every 4 weeks. There are other potential side effects such as diarrhea, of course, appetite suppression, which is what we hope from the drug as well. And we could also have pancreatitis, so we don't use them in people who have had a history of pancreatitis. And it has also been shown to cause medullary thyroid cancer in rats. So it's very important to get a family history and for you to know your family history when you consider taking these drugs. So Saxenda was approved in 2015 and Wegovy got approved in 2021. So what's the data on the weight loss benefits of these drugs? Well, they're pretty profound. Even when we have used these drugs in our diabetics, we've seen profound weight loss as well as improved insulin sensitivity. A lot of patients with the weight loss and improved insulin sensitivity have been able to come off their insulin or cut down significantly on their insulin doses, which is really impressive. So these drugs have really changed how we manage diabetes. So let's talk about the weight loss that we've seen when these drugs are used specifically for obesity or overweight. So Saxenda, which is our once a day injectable, has shown about 12% of body weight loss on average. Wegovy has shown 15% or an average of 35-pound weight loss. And Mounjaro, which is not yet approved for weight loss, showed approximately 20% weight loss, which is very impressive. So they're trying to facilitate Mounjaro being approved for obesity, especially considering what a significant health impact obesity is having at this time. So let's summarize everything when it comes to weight loss injectable drugs. So at this time, there are 2 injectable drugs approved for weight loss. Brand names are Saxenda, which is liraglutide, and Wegovy, which is semaglutide. Saxenda is a once-a-day injectable drug. Wegovy is a once-a-week injectable drug. Victoza and Ozempic are not approved for weight loss. They are approved for the management of diabetes. Mounjaro is a drug on the horizon which is approved for diabetes but not for weight loss as yet, but has been shown to have significant weight loss benefits. It is expected that Mounjaro will be approved either sometimes in the spring or in the summer of this year. So please do not take Ozempic or Victoza if you're not a diabetic. This can result in significant shortages for our diabetic population, and they really need it for control of their blood sugars. And finally, let's just talk about the indications for these drugs. So these drugs are indicated for obese individuals, so people who have a BMI greater than or equal to 30, or in patients who suffer from overweight, who have a BMI greater than or equal to 27, but also have a weight-related chronic illness. Remember as well that these drugs are indicated as an adjunct to healthy eating and exercise. Once again, I'm Dr. Tessa Gibson. Thank you for joining me today, and I will see you next week when we will be talking about CBD. Thank you.